Welcome to OliTrey's Fun Facts. Here, we bring you amazing facts that revolve around you every day. One thing people always wonder about is whether men are indeed capable of getting pregnant and giving birth, as well as what really makes it possible in the case where they do. We are here to provide you with answers on these thoughts. Before we begin, let us first know the difference between sex and gender, since it is crucial to understand the group of people we are talking about in this video. People often use these two terms interchangeably, and it is incorrect. Sex refers to the physical variations between males, females, and intersex people. At birth, a person's sex is usually assigned based on physiological traits such as genitalia and chromosome composition. On the other hand, gender refers to how a person identifies. Gender is a broad spectrum, unlike sex, which is made up of binary forms. A person may identify at any point within this spectrum or outside of it entirely. Some people identify with genders that are different from their natal sex. These identities may include transgender, non-binary, or gender-neutral, among others. To continue, we will have to dispel some prevalent misunderstandings about what it means to be a man, now that we understand the difference between sex and gender. Not everyone born with a masculine gender identity identifies as a man. Those who do are cisgender men. Conversely, some people who were born with a female gender identify as men. These folks could be transgender guys or transmasculine individuals. Now the big question is it possible for men to give birth? Yes, men are capable of becoming pregnant and giving birth to their own children. In fact, it's a lot more prevalent than you realize. Transgender guys have the reproductive organs necessary to carry a child. There are also emerging technologies that may make it possible for people who were born with a male gender but identify as females to carry a child, likewise cisgender men. The reason why transgender guys are able to carry pregnancy and give birth is because most of them have uterus and ovaries they retain. Regardless of prior hormone replacement therapy treatments, the progression of pregnancy and birthing procedures are typically the same as those of cisgender women. For transgender guys who take testosterone, menses typically stop within 6 months of starting hormone replacement therapy, HRT. Such people need to stop the use of testosterone to be able to conceive. It is not entirely unheard of for people who are on testosterone to become pregnant from having unprotected vaginal sex. While there's very little research that's been conducted on gender non-conforming pregnancies, one thing that remains obvious is men, transgender males in this case, are able to carry pregnancy and give birth once they maintain their uterus and ovaries. Hit the like and subscribe buttons if you learned something today. Also, don't forget to hit on the notification button to always be notified when we upload more fun videos with similar contents.